Question 1. Which of this following define time from fertilization of the ovum until the estimated date of delivery? A. Gravidity. B. Aprimapa. C. Gestation. D. Maternity. Answer 1. C. A gestation is the time from fertilization of the ovum until the estimated date of delivery. It is about 280 days. Question 2. A client at 36 weeks gestation is scheduled for a routine ultrasound prior to amniocentesis. After teaching the client about the purpose of the ultrasound, which of the following client statements would indicate to the nurse in charge that the client needs further instruction? A. The ultrasound will help to locate the placenta. B. The ultrasound identifies blood flow through the umbilical cord. C. The test will determine where to insert the needle. D. The ultrasound locates a pool of amniotic fluid. Answer 2, B. The ultrasound identifies blood flow through the umbilical cord. Before amniocentesis, a routine ultrasound is valuable in locating the placenta, locating a pool of amniotic fluid, and showing the physician where to insert the needle. Color Doppler imaging ultrasonography identifies blood flow through the umbilical cord. Question 3. Nurse Sherry is educating a group of women on signs of pregancy. Which of the following is not one of the presumptive signs of pregancy? A. Pronounced nipples. B. Urinary frequency. C. Uterine enlargement. D. Quickening. Answer 3, C. Presumptive signs of pregancy include amenorrhea, nausea and vomiting, increased size and increased feeling of fullness in breasts, pronounced nipples, urinary frequency, fatigue, discoloration of the vaginal mucosa. Uterine enlargement is one of the probable signs of pregnancy. Question 4. Fetal heart rate detected by non-electronic device, fetoscope, at what weeks? A. 22 weeks. B. 36 weeks. C. 16 weeks. D. 20 weeks. Answer 4, D. Fetal heart rate is detected by electronic device, Doppler transducer, at 10 to 12 weeks, and by non-electronic device, fetoscope, at 20 weeks of gestation. Question 5. During a prenatal visit at 4 months gestation, a pregnant client asks whether tests can be done to identify fetal abnormalities. Between 18 and 40 weeks gestation, which procedure is used to detect fetal anomalies? A. Amniocentesis. B. Chorionic villi sampling. C. Fetoscopy. D. Ultrasound. Answer 5, D. Ultrasound is used between 18 and 40 weeks gestation to identify normal fetal growth and detect fetal anomalies and other problems. Amniocentesis is done during the 3rd trimester to determine fetal lung maturity. Chorionic villi sampling is performed at 8 to 12 weeks gestation to detect genetic disease. Fetoscopy is done at approximately 18 weeks gestation to observe the fetus directly and obtain a skin or blood sample. Question 6. The nurse in charge is reviewing a patient's prenatal history. Which finding indicates a genetic risk factor? A. The patient is 25 years old. B. The patient has a child with cystic fibrosis. C. The patient was exposed to rubella at 36 weeks gestation. D. The patient has a history of preterm labor at 32 weeks gestation. Answer 6, B. Cystic fibrosis is a recessive trait. Each offspring has a 1 in 4 chance of having the trait or the disorder. Question 7. A patient with pregnancy-induced hypertension probably exhibits which of the following symptoms? A. Proteinuria, Headaches, vaginal bleeding. B. Headaches, double vision, vaginal bleeding. C. Proteinuria, headaches, double vision. D. Proteinuria, double vision, uterine contraction. Answer 7, C. A patient with pregnancy-induced hypertension complains of a headache, double vision, and sudden weight gain. A urine specimen reveals proteinuria. Question 8. The nurse is developing a teaching plan for a patient who is 8 weeks pregnant. The nurse should tell the patient that she can expect to feel the fetus move at which time? A. Between 10 and 12 weeks gestation. B. Between 16 and 20 weeks gestation. C. Between 21 and 23 weeks gestation. D. Between 24 and 26 weeks gestation. Answer 8, B. Quickening. The first perception of fetal movement by the mother may occur at the 16th to 20th week of gestation. Question 9. A pregnant patient asks the nurse if she can take castor oil for her constipation. How should the nurse respond? A. Yes, it produces no adverse effect. B. No, it can initiate premature uterine contractions. C. No, it can promote sodium retention. D. No, it can lead to increased absorption of fat-soluble vitamins. Answer 9, B. Castor oil can initiate premature uterine contractions in pregnant women. It also can produce other adverse effects, but it does not promote sodium retention. Question 10. The nurse is counseling a couple who has sought information about conceiving. The couple asks the nurse to explain when ovulation usually occurs. Which statement by the nurse is correct? A. 2 weeks before menstruation. B. Immediately after menstruation. C. Immediately before menstruation. D. 3 weeks before menstruation. Answer 10, A. Ovulation occurs 14 days before the first day of the menstrual period. Although ovulation can occur in the middle of the cycle or 2 weeks after menstruation, this is only true for a woman who has a perfect 28-day cycle. For many women, the length of the menstrual cycle varies. Question 11. When assessing the adequacy of sperm for conception to occur, which of the following is the most useful criterion? A. Sperm count. B. Sperm motility. C. Sperm maturity. D. Semen volume. Answer 11, B. Although all of the factors listed are important, sperm motility is the most significant criterion when assessing male infertility. To reach and fertilize an egg, sperm must move wriggling and swimming through a woman's cervix, uterus, and fallopian tubes. This is known as motility. Males are most likely to be fertile if at least 40% of their sperm are moving. Question 12. Which of the following represents the average amount of weight gained during pregnancy? A. 12 to 22 pounds. B. 15 to 25 pounds. C. 25 to 35 pounds. D. 25 to 40 pounds. Answer 12, C. The average expected weight gain during pregnancy is 25 to 35 pounds, 11 to 16 kilograms, for women with a normal pre-pregnancy weight. Question 13. In which of the following areas would the nurse expect to observe CHLOASMA? A. Breast, areola, and nipples. B. Chest, neck, arms, and legs. C. Abdomen, breast, and thighs. D. Cheeks, forehead, and nose. Answer 13, D. CHLOASMA, also called the mask of pregnancy, is an irregular hyperpigmented area found on the face. It is not seen on the breasts, areola, nipples, chest, neck, arms, legs, abdomen, or thighs. Question 14. Which of the following urinary symptoms does the pregnant woman most frequently experience during the first trimester? A. Dysuria. B. Frequency. C. Incontinence. D. Burning. Answer 14, B. Pressure and irritation of the bladder by the growing uterus during the first trimester is responsible for causing urinary frequency. Question 15. Cervical softening and uterine souffle are classified as which of the following? A. Diagnostic signs. B. Presumptive signs. C. Probable signs. D. Positive signs. Answer 15, C. Cervical softening, good sign, and uterine souffle are two probable signs of pregnancy. Probable signs are objective findings that strongly suggest pregnancy. Other probable signs include Hager sign, which is softening of the lower uterine segment, uterine enlargement, ballottement, Chadwick's sign, Braxton Hicks contractions. 16. When preparing to listen to the fetal heart rate at 12 weeks gestation, the nurse would use which of the following? A. Stethoscope placed midline at the umbilicus. B. Doppler placed midline at the suprapubic region. C. Fetoscope placed midway between the umbilicus and the xiphoid process. D. External electronic fetal monitor placed at the umbilicus. Answer 16, B. At 12 weeks gestation, the uterus rises out of the pelvis and is palpable above the symphysis pubis. The Doppler intensifies the sound of the fetal pulse rate so it is audible. The uterus has merely risen out of the pelvis into the abdominal cavity and is not at the level of the umbilicus. Question 17. Before birth, which of the following structures connects the right and left auricles of the heart? A. Umbilical vein. B. Foramen ovale. C. Ductus arteriosus. D. Ductus venosus. Answer 17, B. The foramen ovale is an opening between the right and left auricles that should close shortly after birth so the newborn will not have a murmur or mixed blood traveling through the vascular system. Question 18. Which of the following refers to the single cell that reproduces itself after conception? A. Chromosome. B. Blastocyst. C. Zygote. D. Sperm. Answer 18, C. The zygote is the single cell that reproduces itself after conception. It is the union of the sperm cell and the egg cell. Also known as a fertilized ovum, the zygote begins as a single cell but divides rapidly in the days following fertilization. After this 2-week period of cell division, the zygote eventually becomes an embryo. If this goes well, the embryo becomes a fetus. Question 19. Which of the following test is done to detect genetic abnormalities? A. Fetoprotein. B. Doppler blood flow analysis. C. Fibronectin test. D. Chorionic villus sampling. Answer 19, D. Performed for the purpose of detecting genetic abnormalities, the HCP aspirates a small sample of chorionic villus tissue at 10 to 13 weeks of gestation. Question 20. During a pelvic exam, the nurse notes a purple-blue tinge of the cervix. The nurse documents this as which of the following? A. Braxton Hicks sign. B. Chadwick's sign. C. Goodell's sign. D. McDonald's sign. Answer 20, C. Chadwick's sign is a bluish discoloration of the cervix, vagina, and labia resulting from increased blood flow. It can be observed as early as 6 to 8 weeks after conception, and its presence is an early sign of pregnancy.